Good day everyone, I am Chela Francisco Abrique and we are still under the topic of integrative perspective. I will discuss about the place of techniques and evaluation in counseling that involves drawing on techniques from various approaches and evaluating the effectiveness of counseling and therapy. So, an integrative therapist may combine elements of psychoanalytic, cognitive, behavioral, humanistic, or other therapies into a personal therapy style applied to a wide range of clients that depends on the individual's needs, personality, and goals. Much also depends on the purpose of the therapy, the setting, the personality, and the style of the therapist, the qualities of the particular client, and the problems selected for intervention. Also, the therapist must decide what relationship style to adopt, anong mga techniques, procedures, or intervention na gagamitin niya, when to use them, and with which clients. So according to Norcross and Newman, the lack of differential effectiveness among therapies and the recognition that common factors contribute significantly to therapy outcome are two of the factors that have fostered the popularity of integrative forms of psychotherapy. So thus, integrative therapists are concerned with synthesizing the best features of various theories of psychotherapy. In integrative approach, theory and practice are in a dialectical relationship, each forming the other. That means that the theory gives rise to the practice and the practice in turn enables the theory to be further developed. So why do we really need a theory? Prochaska and Norcross 2010 said that without a guiding theory, clinicians would be vulnerable, directionless creatures bombarded with literally hundreds of impressions and pieces of information in a single session. It is more important to ask about color preferences, early memories, parent relationships, life's meaning, disturbing emotions, environmental reinforcers through processes, sexual conflicts, or something else in the first interview. So, effective counseling involves proficiency in a combination of cognitive, affective, and behavioral techniques. Such a combination is necessary to help clients think about their beliefs and assumptions, to experience a feeling level that conflicts and struggles, and to translate their insights into action programs by behaving in new ways in day-to-day living. In integrative perspective, there is an integration of different therapeutic techniques in a client. So now we will review the different techniques of the different therapies. So in my written report, I have also included there the techniques, the applications, the contributions to multicultural counseling, the limitations to multicultural counseling, the contributions of the approach, and the limitations of the approach. But particularly, I will only be discussing in this report the techniques from various approaches. So first, we have the psychoanalytic therapy. So, the techniques of psychoanalytic therapy involves interpretation, dream analysis, free association, analysis of resistance, analysis of transference, and understanding countertransference. So, psychoanalytic therapy is used by professionals who want to become therapists, people who have had intensive therapy and want to go further, and those who are in psychological pain. So this type of therapy is not recommended for self-centered and impulsive individuals or for people with psychotic disorders. And also this can be applied to both the individual and group therapy. Next, we have the Adlerian therapy. So for its techniques, it uses the subjective experiences of clients. Its techniques involves gathering life history data such as family constellation, early recollections, or personal priorities. Then we also have the sharing interpretations with clients, offering encouragement and assisting clients in searching for new possibilities. So this approach is based on a growth model. It is applicable to such varied spheres of life as child guidance, parent-child counseling, marital and family therapy, individual counseling with all age groups, correctional and rehabilitation counseling, group counseling, substance abuse programs, and brief counseling. It is also ideally suited to preventive care and alleviating a broad range of conditions that interfere with growth. Third, we have the existential therapy. So, this therapy emphasizes understanding first and technique second. So this existential therapy borrow techniques from other approaches and incorporate them in an existential framework. Diagnosis, testing, and external measurements are not deemed important. Issues addressed here are freedom and responsibility, isolation and relationships, meaning and meaninglessness, living and dying. So this approach is especially suited to people facing a developmental crisis or a transition in life, and for those with existential concerns or those seeking personal enhancement. This approach can be applied to both individual and group counseling, and to couples and family therapy, crisis intervention, and community mental health work. Fourth, we have the person-centered therapy. So, person-centered therapy uses few techniques but stresses the attitudes of the therapist and a way of being. Therapists strive for active listening, reflection of feelings, clarification, and being there for the client. It does not include diagnostic testing, interpretation, taking a case history, or questioning or probing for information. So this person-centered therapy is widely applicable to individual and group counseling. It is also especially well suited for the initial phases of crisis intervention work. Its principles have been applied to couples and family therapy, community programs, administration and management, and human relations training. It is also a useful approach for teaching, parent-child relations, and for working with groups of people from diverse cultural backgrounds. Next, fifth, we have the Gestalt therapy. So, a wide range of experiments are designed to intensify experiencing and to integrate conflicting feelings. Experiments are co-created by therapist and client through an I-thou dialogue. Therapists have latitude to creatively invent their own experiments. Formal diagnosis and testing are not a required part of therapy. So this Gestalt therapy addresses a wide range of problems and populations. Crisis intervention, treatment of a range of psychosomatic disorders, couples and family therapy, awareness training of mental health professionals, behavior problems in children, and teaching and learning. It is also well suited to both individual and group counseling. The methods are powerful catalysts for opening up feelings and getting clients into contact with their present-centered experience. Sixth, we have the behavior therapy. So the main techniques are reinforcement, shaping, modeling, systematic desensitization, relaxation methods, flooding, eye movement and desensitization reprocessing, cognitive restructuring, assertion and social skills training, self-management programs, mindfulness and acceptance methods, behavioral rehearsal, coaching, and various multimodal therapy techniques. Diagnosis or assessment is done at the outset to determine a treatment plan. Questions concentrate on what, how, and when, but not why. Contracts and homework assignments are also typically used. So this behavior therapy enjoys wide applicability to individual, group, couples and family counseling. Some problems to which the approach is well suited are phobic disorders, depression, trauma, sexual disorders, children's behavioral disorders, stuttering, and prevention of cardiovascular disease. Beyond clinical practice, its principles are applied in fields such as pediatrics, stress management, behavioral medicine, education, and geriatrics. Seventh, we have the cognitive behavior therapy or the CBT. For its techniques, therapists use a variety of cognitive, emotive, and behavioral techniques. Diverse methods are tailored to suit individual clients. So this cognitive behavior therapy is an active, directive, time-limited, present-centered, psychoeducational, structured therapy. Some techniques include engaging in Socratic dialogue, collaborative empiricism, debating irrational beliefs, carrying out homework assignments, gathering data on assumptions one has made, keeping a record of activities, forming alternative interpretations, learning new coping skills, changing one's language and thinking patterns, role-playing, imagery, confronting faulty beliefs, self-instructional training, and stress inoculation training. So this cognitive behavior therapy has been widely applied to treatment of depression, anxiety, relationship problems, stress management, skill training, substance abuse, assertion training, eating disorders, panic attacks, performance anxiety, and social phobias. CBT is especially useful for assisting people in modifying their cognitions. Many self-help approaches utilize its principle. CBT can be applied to a wide range of client populations with a variety of specific problems. 8. We have the reality therapy. So this reality therapy is an active, directive, and didactic therapy. Various techniques may be used to get clients to evaluate what they are presently doing to see if they are willing to change. If clients decide that their present behavior is not effective, they develop a specific plan for change and make a commitment to follow through. So this reality therapy is geared to teaching people ways of using choice theory in everyday living to increase effective behaviors. It has also been applied to individual counseling with a wide range of clients, group counseling, working with youthful law offenders, and couples and family therapy. In some instances, it is well suited to brief therapy and crisis intervention. Number 9, we have the feminist therapy. Although techniques from traditional approaches are used, feminist practitioners tend to employ consciousness-raising techniques aimed at helping clients recognize the impact of gender role socialization on their lives. Other techniques frequently used includes gender role analysis and intervention, power analysis and intervention, demystifying therapy, bibliotherapy, journal writing, therapist self-disclosure, assertiveness training, reframing and relabeling, cognitive restructuring, identifying and challenging untested beliefs, role-playing, psychodramatic methods, group work, and social action. So the principles and techniques can be applied to a range of therapeutic modalities such as individual therapy, relationship counseling, family therapy, group counseling, and community intervention. So this approach, the feminist therapy, can be applied to both women and men with the goal of bringing about empowerment. Number 10, we have the postmodern approaches. So in solution-focused therapy under the postmodern approaches, the main technique involves change talk, with emphasis on times in a client's life when the problem was not a problem. Other techniques include creative use of questioning, the miracle question, and scaling questions, which assist clients in developing alternative stories. In narrative therapy naman, Specific techniques include listening to a client's problem-saturated story without getting stuck, externalizing and naming the problem, externalizing conversations, and discovering clues to competence. Narrative therapists often write letters to clients and assist them in finding an audience that will support their changes and new stories. So this solution-focused therapy is well suited for people with adjustment disorders and for problems of anxiety and depression. Narrative therapy naman is now being used for a broad range of human difficulties including eating disorders, family distress, depression, and relationship concerns. So these approaches can be applied to working with children, adolescents, adults, couples, families, and the community in a wide variety of settings. Both solution-focused and narrative approaches lend themselves to group counseling. And lastly, we have the family systems therapy. So a variety of techniques may be used depending on the particular theoretical orientation of the therapist. So techniques under family systems therapy includes genograms, teaching, asking questions, joining the family, tracking sequences, issuing directives, use of countertransference, family mapping, reframing, restructuring, enactments, and setting boundaries. Also, techniques may be experiential, cognitive, or behavioral in nature. Most are designed to bring about change in a short time. So this family systems therapy is useful for dealing with marital distress, problems of communicating among family members, power struggles, crisis situations in the family, helping individuals attain their potential, and enhancing the overall functioning of the family. Now, let us discuss about the evaluation of the effectiveness of counseling and therapy. So how effective is psychotherapy? A meta-analysis of psychotherapy outcome literature conducted by Smith, Glass, and Miller in 1980 concluded that psychotherapy was highly effective. Prochaska and Narcus on 2014 noted that controlled outcome research consistently supports the effectiveness of psychotherapy. Psychotherapy is an efficacious approach to helping people who experience psychological distress improve their functioning, according to Miller and colleagues in 2015. On 2011 naman, Lambert's review of psychotherapy research makes it clear that the similarities rather than the differences of models account for the effectiveness of psychotherapy. According to Elkins, interpersonal, social, and affective factors common across therapeutic orientations are the primary determinants of effectiveness of psychotherapy. Lambert believes the future direction of theory, practice, and training will see, first, the decline of single theory practice and the growth of integrative therapies, and second, the increase in short-term, time-limited, and group treatments that seem to be as effective as long-term individual treatments with many client populations. Although it is clear that therapy works, there are no simple explanations of how it works, and it appears that we must look to factors that are common to all therapeutic approaches. Hubble, Duncan, Miller, and Wampold in 2010 summarized research studies in the field and found that the following four factors account for change in therapy. Client factors, 40%. Alliance factors, the therapeutic relationship, 30%. Expectancy factors, or the hope and the allegiance, 15%. Theoretical models and techniques, also 15%. Common factors that are part of all theoretical orientations are critical to therapeutic outcome. Wampold in 2010 concludes that there is little evidence that the specific ingredients of any treatment are responsible for the benefits of therapy. Research indicates that a variety of treatments are equally effective when administered by therapists who believe in them and when they are accepted by the client. The various therapy approaches and techniques work equally because they share the most important ingredient accounting for change, which is the client. Data points to the conclusion that the engine of change is the client, and we can almost productively direct our efforts toward ways of employing the client in the process of change. Duncan and colleagues further stated that therapists can translate this research into their clinical work by purposefully working to the following. First, to enhance the common factors across all theories that account for successful outcomes. Second, focus on the client's perspective and theory of change as a guide to selecting techniques and integrating various therapy models. Third, obtain systematic client feedback regarding the client's experience of the process and outcome of therapy. Hubble, Duncan, Miller, and Wampold 2010 noted that monitoring outcome and adjusting accordingly on the basis of feedback from the client must become routine practice. Speaking of feedback informed treatment, or the FIT, is designed to evaluate and to improve the quality and effectiveness of counseling services. FIT is an evidence-based practice that monitors client change and identifies modifications needed to enhance the therapeutic endeavor. FIT involves consistently obtaining feedback from clients regarding the therapeutic relationship and their clinical progress, which is then used to tailor therapy to their unique needs. If therapists learn to listen to clients' feedback throughout the therapeutic process, clients can become full and equal participants in all aspects of their therapy. This approach to practice requires continuous active client input, which is the most significant predictor of change in therapy. Scott Miller and his associates at the International Center for Clinical Excellence developed two 4-item instruments to measure client progress and to rate the quality of the therapeutic relationship. So these rating instruments are brief, well-validated, and client-rated scales rather. First, we have the outcome rating scales, or the ORS. It assesses the client's therapeutic progress through ratings of client's personal experience of well-being in his or her individual, interpersonal, and social functioning. Second, we have the session rating scale, or the SRS, that measures a client's perception of the quality of the therapeutic relationship, which includes the relational bond with the therapist, the perceived collaboration around specific tasks in therapy, and agreement on goals, methods, and client preferences. Feedback from clients regarding the therapeutic alliance and outcomes increases the effect of treatment, cuts dropout rates in half, and decreases the risk of deterioration. Using client feedback, therapists can adjust and accommodate to maximize beneficial outcomes for clients. In essence, Duncan, Miller, and Sparks in 2014 are arguing for practice-based evidence rather than evidence-based practice. Becoming outcome-informed not only amplifies the client's voice but offers the most viable, research-tested method to improve clinical effectiveness. Client strengths and perceptions are the foundation of therapy work. Systematic and consistent assessment of the client's perceptions of progress allows the therapist to customize the therapy to the individual needs and characteristics of each client. Ongoing client feedback provides practitioners with a simple, practical, and meaningful method for documenting the usefulness of treatment. Next, we will also discuss Stan's case using integration of therapies, or the integrative perspective. So Stan is given a chance to say how he feels about coming to the initial session. Next, there will be a discussion of the mutual responsibilities and a clear statement of what Stan wants to obtain after the therapy. Person-centered, existential, gestalt, feminist, postmodern, and Adlerian approaches influence in establishing the therapeutic relationship. In clarifying goals of the therapy, specificity is a must. So the use of the Adlerian lifestyle questionnaire would indicate some of the themes that originates from Stan's childhood. On the other hand, the psychoanalytic approach naman will uncover re-experience his traumas in early childhood. Furthermore, Gestalt therapy would be used in order for Stan to bring into here and now those people in his life with whom he feels unfinished. Presently, it seems essential to work with Stan's thinking, actual doing, and how his thoughts and behaviors affect his feelings state. So, Adlerian therapy would help Stan to know his goals in life. And the present-oriented behavior focus of reality therapy naman is a good reference point for getting Stan to dream about what he would like to say about his life 5 years hence. Next, person-centered approach stresses the first stage in the therapy process. It aims to identify, clarify, and learn how to express feelings. Next, we have the Gestalt therapy, which would help Stan express and explore his feelings, wherein Stan talk about his relationship with his father. Stan is also encouraged to bring whatever reactions he is having into the present. Also, experiential therapies provide valuable tools for guiding him to the expression of his feelings. Next, some cognitive work is essential. So, an Adlerian perspective provides tools for doing some productive cognitive work both in and out of the therapy session. From rational emotive behavior therapy naman, learning to think rationally is also valued. So, it would also help Stan. Also, the cognitive behavioral therapies have a range of cognitive techniques that can help Stan to recognize connections between his cognitions and his behaviors, such as in dealing with women. Also, cognitive restructuring is also a goal. Stan's therapy is also influenced by the constructivist trend in cognitive behavior therapy. For Stan to evaluate his own thinking process and his conclusions, Socratic questioning would also be useful. In the example, or in his case, the situation is he feels stupid. Stan's cognitive distortions involves arbitrary influences, overgeneralization, personalization, labeling and mislabeling, and polarized thinking. So, therefore, Adlerian therapy, behavior therapy, reality therapy, rational emotive behavior therapy, cognitive therapy, narrative therapy, and solution-focused brief therapy give central emphasis to the role of action as a prerequisite for change. Behavior therapy offers a multitude of techniques for behavioral change, which in his case, mindfulness techniques that can be coupled with both Adlerian and cognitive approaches. Through rational emotive behavior therapy naman, we can explore his faulty assumptions, such that in his approach to a professor with whom he is having difficulty. Next, drawing on cognitive, emotive, and behavioral techniques are used also in order to encourage Stan to make new decisions. Few techniques employed are role-playing, fantasy and imagery, assertion training procedures, and behavioral rehearsals. So one assumption is that many of his problems stem from his family of origin experiences, and that is he is still being affected by these experiences. He is part of this system, and as he changes, it is bound to influence also others in his family with whom he has contact, which is under the family system's perspective. Stan also has intentions to bring up his concerns about his spirituality at a future session. And all of that 11 therapeutic approaches addresses drug and alcohol abuse in different ways. All probably agree that it is imperative at some point in Stan's therapy to confront him on the probability that he is a chemically dependent person. Then, Stan has clear indications that he has learned a great deal about himself through individual counseling. Stan can also benefit from a group experience. So, effective counseling begins where the client is, not where a theory indicates a client should be. A person-centered focus respects the wisdom within the client and uses it as a leader or as a lead for where to go next. So as we can see in the case of Stan, it has integrated many or out of that 11 therapeutic approaches. In the case of Stan, we have integrated many of the therapeutic techniques or the psychotherapy approaches. In the case of Stan, we can see that effective counseling involves proficiency in a combination of, first we have dealt with Stan's cognitive aspect. Next, we have also dealt with Stan's affective aspect. And lastly, we have dealt with his behavioral aspects. So such a combination is necessary to help Stan to think about his beliefs and assumptions, also to experience his feelings And lastly, to translate his insights into action programs by behaving in a new way in dealing with day-to-day living. Now let us move on to the summary of integrative perspective. Integrative perspective opens to various ways of integrating diverse theories and techniques. In psychotherapy integration, it attempts to look beyond and across the confines of single school approaches to see what can be learned from other perspectives. There are four common pathways toward integration of psychotherapies. We have the technical eclecticism, theoretical integration, common factors approach, and lastly, we have the assimilative integration. So the ultimate goal of integration is to enhance the efficiency and applicability of psychotherapy. We also have discussed about the integration of multicultural issues in counseling and also the integration of spiritual religious issues in counseling. So there is a challenge of developing an integrative perspective such that in mixing of theories. Issues related to the therapeutic process includes therapeutic goals, therapist's function and role, client's experience in therapy, and the relationship between therapist and client. In forming an integrated perspective, it is important to ask which theories provide the basis for understanding the cognitive dimensions. What about the feelings aspect? And how about the behavioral dimensions? Simply put, you cannot integrate what you do not know. Besides considering your own personality, think about what concepts and techniques work best with a range of clients. It requires knowledge, skill, art, and experience to be able to determine what techniques are suitable for particular problems. It is also an art to know when and how to use a particular therapeutic intervention. Your use of techniques needs to be grounded on solid theoretical intervention. Ethical practice implies that you employ efficacious procedures in dealing with clients and their problems, and that you are able to provide a theoretical rationale for the interventions you make in your clinical work. Also, you must consider from which therapies you would be most inclined to draw on underlying assumptions, on major concepts, on therapeutic goals, on therapeutic relationship, and on techniques and procedures. Also consider the major applications of each of the therapies as well as their basic limitations and major contributions. We also have tackled about the different therapeutic techniques. We have tackled about the techniques of the therapy, its applications, its contributions, and its limitations to multicultural counseling, and also its contributions and limitations to the approach. We tackled about the psychoanalytic therapy, the Adlerian therapy, the existential therapy, the person-centered therapy, the gestalt therapy, the behavior therapy, the cognitive behavior therapy, the reality therapy, the feminist therapy, the postmodern approaches, and lastly, the family systems therapy. Also, we had an example such that in the case of Stan. First, in the case of Stan, using integrative approach, we have clarified that first we clarified the therapeutic relationship. Second, we clarified the goals. Next, we have worked with Stan's past, present, and future. Next, we have identified and explored his feelings. Also, we have tackled about his thinking dimension or his cognitive. Next, we have done an essential component of therapy. Next, we have worked toward his revised decisions. We also have encouraged Stan to work with his family origin. Also, we tackled about his spiritual dimension. And also, we have worked with Stan's drinking problem. Next, we have his termination of therapy. And lastly, we have encouraged Stan to join a therapy group. And that would be all for our report and integrative perspective. Thank you for listening and God bless.